Okay, so we have total physical therapy here today. We're going to demonstrate a couple little simple concepts when it comes to kinesio tape. We're going to focus on the hip today. We're going to work on the piriformis muscle, which actually travels from our tailbone over here to the outer aspect of the hip. The muscle itself helps to produce this motion right here, what we call external rotation. And oftentimes with runners it becomes overstressed, fatigued to the point where we actually have some breakdown or we just have some underlying weakness to begin with. So the simple concepts of kinesio tape that we want to apply here is less is more. So when we look at this piece of tape that's already been pre-cut to the length of this muscle belly or close to the length of it, we want to actually apply a very low load, a very light stretch to the tape, not an aggressive stretch of the tape where we might be able to double the length of the tape. We don't want to do that in this case. More stretch you have on the tape produces a different desired outcome. So for this concept here, we're going to consider the fact that this muscle is fatigued. It's in a weakened state. We'd actually like to increase the activity out of the muscle tissue. Anytime we want to increase the activity or increase the load of the tape, what we want to do is we want to tape close to the midline of the body. This muscle again is going to travel from this point outward to the outer aspect of the hip. And if we tape from the midline of the body out to its attachment site, we should encourage an increased tone to the muscle. With kinesio taping, anytime you tape a structure, you want to make sure you put that structure in a lengthened position for a couple factors. Probably the biggest factor is it will help reduce the likelihood that the tape will actually peel off of the skin. So we'd want to be applying this obviously to the bare skin, but for our model today we're going to tape right over her pants here. So what we're going to do is we're going to take this muscle and we're going to put it into a lengthened or stretched position. And from being on the side right here, what we want to do is pull the hip up. We're just going to drape this across. It'll pull it into rotation in the opposite direction. So now we've got the muscle belly in a lengthened state. For the kinesio tape itself, what we want to do is we want to start with about a half inch to a 1 inch anchor. So we're going to peel this paper backing off. At this point, we don't have any stretch on the anchor here. We don't ever want a stretch or a pull on either end of the tape. So we're going to come over here to the point where the muscle belly starts. We're just going to apply the anchor down with no tension. From this point here, the muscle belly is traveling in this direction over here to the outer aspect of the hip. The tape itself has a very light, low-grade stretch applied to it, straight from the manufacturer when laid down onto the tape. So we want to maintain at least that tension, if not just a little bit more. So we're going to initially peel back the paper backing so we can drape our fingers completely across the tape. We're going to maintain at least that tension of the paper backing as we travel out to the outer aspect of the hip. From here, what we want to do is we want to take the last inch of the tape off of tension and just lay that tape down as it approaches right to the end of the insertion point. Just apply a little bit of light pressure and friction to heat the tape and set the adhesive. Bring the leg back, move the leg freely, make sure that the tape is not binding in any ways. How does the tape feel?
Fine. Feels good.
So this is a taping technique that would actually encourage more activity or more tone of the piriformis muscle.